Hi guys, this is Charles. I'm one of the surgeons at Southpaws. We have this little French bulldog that presented with a history of acute onset hind limb paralysis. And so totally normal up until now. He's about 5 or 6 years of age and then acutely became paralyzed this weekend. Now when we did the CT scan and you look at this scan here, you can see a bunch of abnormalities in the caudal thoracic spine, and especially when you look up underneath, you can see how abnormal his spinal column really is. So you've got all kinds of hemivertebrae, blocked vertebrae, butterfly vertebrae. It's just a congenital mess. Now your tendency would be to say that's why he's paralyzed, but this is not going to cause acute paralysis in a dog. And so this is something that might cause chronic problems over time, but not acute problems. And so when we look at the CT myelogram, and you can see the spinal cord around, which has the dye around it right here, as we go through the thoracic spine. So this is cervical spine, and then going through thoracic spine, you can see all of these really abnormal, congenitally really screwed up vertebrae, but all the way through it, the spinal cord is completely intact, so there's no compression there. And we go down past the end of there's a little disc there, but there's no dorsal compression of the dye column. So when we get into the lumbar vertebrae, that's when you see the compression. So this is just a real lesson to not to automatically assume that when you see the congenital abnormalities in an acutely paralyzed dog, that's unlikely to be the problem. So this dog clearly has another issue, which is the disc rupture. So anyway, interesting CT scan. We're on our way into surgery. We don't have consent to live stream, but I will let you know how it goes. Thanks a lot, and we'll talk to you again soon.